Are you single, senior, and ready to mingle? Well, apparently senior citizens are getting their post-COVID pandemic groove back. SBS Dateline, a channel on YouTube, posted a journalistic episode titled Senior Sex in the City. Although it's not a TV series like Sex in the City, it goes down in New York City. SBS Dateline interviews attendees of a senior citizen speed dating event in New York City organized by Gail Adams. The speed dating event is held for men and women ages 57 to 72. We also get to meet Patty Retroage, a vivacious and very sexual senior citizen. Can you say super cougar? I literally blushed when Hattie shared about her toys and told us about her appetite. Sexual, that is. Yes, sexual toys and her sexual appetite. We also get to meet Alejandra, if I'm pronouncing his name correctly, a super nice guy. He actually attended the speed dating event. And he was once married, but he's nervous about dating again, so late in age, and he hasn't been out there in the dating pool in a long time. He's nervous about being able to perform, if you know what I mean. But Alejandra really touched me when he shared about really wanting, to experience true love and intimacy before leaving this earth because, the material things are not as important as having love. And I think we can all relate to that. I actually teared up and I'm rooting for Alejandra. We also, I believe it's like an expert who gets interviewed and some other attendees of the Speed Dating Network are interviewed as well. But really check it out. The episode at SBS Dateline, and I've shared the link below to make it easier for you. And give me some feedback on the episode. I thought it was very enlightening. I'm just hoping and rooting for everyone to find love again, no matter your age. The decision on what Medicare health insurance plan to enroll in when you turn 65 years old can be intimidating. For over 10 years, Stacey Jones has helped consumers navigate Medicare and make the process easier. She's considered an expert in the Medicare segment of health insurance industry. Now, prior to her insurance career, Stacey was a working model for the Ford Model Agency and has owned several successful businesses, including the Harlem, New York territory for the Subway Sandwich Shop franchise, which led to her appearance as a contestant on season 2 of Donald Trump's The Apprentice. An undergraduate of Emory University and Mercer University, where she received her MBA. Every day, Stacey helps people just like you with their insurance needs, and she does it with pride as the owner of the Jones Insurance Agency. Stacey, thank you so much for joining us today.
Absolutely. Happy to be here.
Now, correct me if I'm wrong, we're at the tail end of October, which is, I guess, Medicare registration month. What should a 65-year-old person do right now?
Okay, so right now we're during it's called annual enrollment period, AE. It's the annual enrollment period. So basically, every year between October 15th and December 7th, anyone who has a Medicare plan between the ages of 65 and over, and actually you can actually come in early for Medicare due to a disability, but anyone with a Medicare plan has a chance to take another look at their Medicare plan, make sure it's the best one for them, and they have the right to change plans during this period. So within the 6-week period, we're in that right now. So needless to say, this is the most busiest time of the year for me. So you see all the commercials on TV and everyone is like, what should I do? Do I have the best plan? So, the phones start ringing.
Okay. And, honestly, I didn't know that you can switch your plan. I thought that once you got Medicare, you're stuck. So can you break down, I guess, the basics of Medicare?
So it's just like if you work for a company. Every year, the company can either renew that health insurance or they can switch. Let's say they're with United Healthcare. If the company no longer wants that insurance for their employees, then they have an enrollment period every single year where they can switch to Aetna, Health First, whatever your options are in your state that you live in. So just like that, Medicare is the same way. So what I tell all the clients when I'm enrolling someone, let's get the plan that's right for you now, because next year, hey, your doctor may go out of network with that plan. During the enrollment period, you can change again. So there's a couple different reasons why a person may want to change a plan. But the goal is when I'm meeting with a person, and I'm basically considered a Medicare specialist. So I advocate for my clients, for the consumer, to get the best plan. Because what you don't want to happen is you put a client into a plan where the doctors don't take the plan, and then they're mad at you. Why did you put me in this plan? So the goal is to always, when you sit down with a potential client, what are your doctors? What are the best plans? What are the extra benefits for you? So.
Okay. So you help do the research for them.
100%. So if you want to start kind of from the beginning of Medicare, it's actually a process. So people may ask, well, who qualifies for Medicare? So Medicare is what's called an entitlement. At age 65 is usually when someone comes into Medicare. And you can't miss it because Social Security sends you letters, because you first have to enroll through Social Security. And so I just want to break it down pretty simple for you. There's 4 parts to Medicare. So when you are turning 65, 3 months prior and then 3 months after your 65th birthday is called your enrollment period, where you won't get a penalty. So Social Security usually sends you out a letter letting you know this, and you will apply for two of the 4 parts of Medicare. So there's 4 parts to Medicare. There's part A and B and part C and D. Okay. So what the client is going to first do, who's interested in their Medicare health insurance, which by the way is the very best health insurance in the United States. So it's a must do when you turn 65. And it's very inexpensive. You have to enroll with Social Security into your part A, which is hospitals, and B, which is medical. Okay, so that's the first step out of the 4 steps. There are 4 parts, A, B, C, and D. So after you get your part A and B, that's where I come in. I'm a Medicare specialist advisor that helps you choose now what health insurance plan, part C, and D for drugs, what drug plan should I attach? So once again, there's 4 parts, A, B, C, and D. And there's so much information on TV, and the person turning 65 is getting a little overwhelmed. They're getting tons of mail from all these different health insurance carriers. And they're like, what direction should I go? Well, this information is all at medicare.gov, or you happen to find someone like me who specializes in the part C and D. So that's pretty much the start. The first step is A and B with Social Security.
Okay, so my father had A and B. He was a vet, so I'm not sure if that's why he didn't have the, was it C and D and E?
Right.
How would you know that the others are beneficial for you?
Okay, and so put it this way. Like I said, there's a lot of commercials on TV, and you're getting a lot of mail. So most people will see, like say Jimmy Walker has a commercial from Good Times. They'll call the number. I think he does United Healthcare. So how do you, and the reason why your father may not have had the part C and D is because veterans have a tremendous amount of health insurance, not to divert towards that, but my dad also is a vet. So he has top of the line veteran insurance, but he also has A and B Medicare because most of his appointments are at the VA still, believe it or not. He loves to go to the VA. The VA has great benefits. Your father was the same or no?
Yes.
Did he go to the VA? So they don't necessarily have to go to hospitals and doctors outside of the VA, unless, of course, they travel. Say my dad, if he's here, I'm in New York. If he wanted to visit me and I live down the street from Mount Sinai, one of the best hospitals, in my opinion, and he doesn't want to go all the way downtown to the VA, well, he doesn't have his Part C and D attached. He doesn't have a health insurance plan and a prescription drug plan. He's limited to only going to the VA because he has not connected his full benefits with Medicare. Now he has Part A and B, but the problem with having A and B, he still can go to a doctor or hospital at Mount Sinai, but he's going to have to pay out of pocket 20% service. So let's say he got,
Real quick, something I guess for vets to consider though, because when my dad went to the emergency room a couple months ago, they took him to a regular hospital. I haven't gotten those bills yet. I guess that would have been covered under C and D, so that's probably something for vets to consider. But I'll let you go on.
No, and just to address that, he most likely will get a bill for 20% of that hospital stay. Did he stay? Did he stay? Okay, so he'll get a bill because with A and B covers 80% of the cost. So the bill will be paid 80%. The 20% now is your responsibility. So say that hospital visit it could easily be $10,000 in New York, so 20% of 10,000, you're going to get a bill for a couple $1,000. Okay, but if you had a C and D attached, which, by the way, veterans can attach their Part C and D. There's plans for veterans with Medicare. So my dad has his Part C and D attached. So I would highly recommend for you to attach one for your dad as well. So they can have both. They can have veteran and they can have their complete Medicare benefits, A, B, C, and D. But right now, he's exposed to a 20% copay, a coinsurance copay. So let's say he fell on the street, went to Mount Sinai, it's a $100,000 bill. They didn't take him to the VA. So 20% of that $100,000, will get a bill for that. But that same bill, if it was a regular, depending on the plan, it could have been an overnight stay, one day in the hospital, it could be $350 copay. So do you want to pay 20% or would you rather pay the $350? So when you attach a plan, you're able to have more options. You're able to go to hospitals, doctors outside of the VA. So, and that's a whole nother conversation, but I want to redirect the conversation a little more to what are the people's choices once they have their Part C and D and what plans that they should choose. Okay. So veterans are they're a big segment, but yet a small segment. The majority of America are going to be looking for Part C and D because they're not veterans. Okay, so now just to continue that, once you've connected the A and B with Social Security, to get rid of that 20%, in most cases, it all goes away once you connect the health insurance plan, which is the Part C and D. So there's several to choose from. You have United Healthcare, Empire Blue Cross Blue Shield, Aetna, Emblem, Health First, WellCare, Fidelis, Kaiser, depending on the part of the country that you live in. So I work most parts of the country. So depending on the client, you call me, I'm going to put your doctor into the Medicare, into the system and see which plan is the best plan for you. That is, if you're married to a doctor, most clients do not want to give up their doctors at all. If they say, hey, it doesn't matter, then I'm going to lean towards what I feel are the top two in your county. Okay. So what you'll do at that point, once you have your Part A and B, now you're ready to sign up for the C and D. Put the doctors into the system and we can choose your Medicare Advantage plan, where there's actually two routes that you can go. You can either go Medicare Advantage plan, which is an HMO. Now, most people are used to HMOs because that's what you get at your job. And HMO means you go to the doctors in the network of a health insurance carrier. So let's just use United Healthcare as the example. So I check your doctor, Dr. Smith, the doctors in United Healthcare's network. Now let's look for how much it's going to cost. So most of these plans, well, believe it or not, the majority of the plans now in New York are $0 a month. They cost $0, all right, to connect your Part C and D. A United Healthcare, just to give you a perspective of this, if you were trying to get an individual plan, can range anywhere from $500 to $1,200 a month, okay? But at age 65, when you have your Medicare Part A and B, it gives you the right to attach the C and D with a United Healthcare or a different carrier for $0. There is no monthly premium on a lot of these plans. Now, it also comes with the drug plan if you go the HMO route, okay? So there's two ways to do it, but you have to go to the doctors in the network. And these plans come with hearing, vision, dental. Some come with transportation, over-the-counter credit cards, where you can go to like a Duane Reade or a CVS and buy vitamins, paper towels, toilet tissue, all kinds of stuff. Comes with a lot of great benefits, and the co-pays, and most of the time they're super low, and a lot of times they're $0. So once you attach a United Healthcare, let's say you want to go get a mammogram, you're not paying 20%. Now that you have the plan attached, that's a preventative service every year. You pay zero. Okay. So mammograms, colonoscopies. Your dad, however, to use as an example, if he goes to Mount Sinai, he wants his colonoscopy there. No, because you're going to have to pay 20% because he doesn't have the C&D attached. They will bill him 20% of whatever that colonoscopy costs, $5,000. Who knows what the cost is? Well, if he went to the VA, of course, it's covered. But if he goes somewhere else, he hasn't connected his health insurance plan, his C and his D. So, got it? So it's to his benefit to go ahead and finish his entire Medicare benefits with his C and D. Right now, his prescriptions can only come from the VA. If he wants an option to go to CVS or Duane Reade, Rite Aid, well, he needs the Part C and D. D means drug plan, D for drug.
Potential client, they can work with you over the phone. Everything's virtual now, pretty much over the phone.
Right.
Is there a fee for them to consult with you regarding their Medicare?
Okay. So no, there's no fee. So if anyone actually asks you for a fee, you should pretty much say, hey, I know this is, free service. I'm sure some agents may try that, but no. So the way I actually make money is I consult people. There's over 10,000 people a day turning 65 for the next over 12 years. It's a very wide open market. It's a great market. And Medicare is an entitlement. It's not going away anytime soon. But once again, to answer that question, there's no fee to work with me. Who pays me is the carrier. So once I look, and that's really key, because for me, I have a very substantial book of business. Okay. And I want to make sure all my clients stay with me every single year, because at open enrollment, which is now, they have a choice to change plans. So when I sit down with the client, you're not paying me as a client. The insurance carrier, I certify with all the top carriers every year to make sure I'm able to offer the client the best choices. So when I sit down with the client, now I can say, hey, you have a choice of all these companies. I'm all certified with them. The company is going to pay me. You're not paying me. Okay. But the goal is to make sure you're with the best company so you don't leave my book of business.
Yeah.
Because I want to retain you.
Exactly. That's what I was going to say. That's a huge relief, I'm sure, for a lot of watchers, because one, they don't have to pay anything out of pocket. Two, they have more peace of mind that you're going to give them the best possible to fit them, because you want them to stay with you each year because they have the right to go elsewhere. So
absolutely,
security, a sense of security, I feel.
Yeah, absolutely. So overall, I can say, it's a free service. It's like a consultation, but at the end, I see the application all the way through. So when I'm sitting with a client, the goal is, this is what I do for a living. I do want to make sure they're placed with the right plan, the Part C and D. So I do all the research for them. Okay, you have 5 doctors. I'm going to put them all in, find which plan is the best. Because what happens is when I first started in this business, the clients would give me all the doctors. I would put them on one plan, and then find out that maybe one of their doctors doesn't take the plan, and then they're calling up complaining and switching plans. So I've lost the client.
Yeah. So
that's called
is that also the peace of mind of going to you rather than them trying to do it on themselves, because they may wind up finding themselves in a situation where, their doctor isn't in the system or under that.
Yeah, of course. And a lot of the clients, they actually get overwhelmed because it's quite a bit to check. You'd have to go to the carrier. You think about the carriers that you want, then you call that carrier. You may find out the doctor's not there. I'm a one-stop shop. I do it all for you. So I'm doing all the research for you. This takes hours, days for the regular person to actually understand how to do that. Now, one thing I do want to also emphasize, if you don't want to be with an HMO, which are most of the free plans, and like I said, they come with hearing, vision, dental, free gym membership, like to a New York Sports Club, a YMCA. These are top of the line plans for $0 a month, and the copays are minimal. Most of the time, they're $0 for a primary or specialist. But you do have to go to the doctors in the network. Like I said, most people are used to that because they've had jobs. But their jobs usually offer the plans that are in the network. But if you said, hey, I don't want that. I want to be able to go to anyone I want, anywhere, any place, anytime, all over the United States. This is called an out-of-network plan. You may have heard of the word PPO. Okay. It's like Let's say you live in Florida half-time, part-time, and you have doctors down there. Or you have doctors that say, hey, I don't want to take Medicare. Believe it or not, there are doctors here in New York that take no insurance, but they do. I mean, this is New York. I mean, people are going to pay top of the line. They'll pay thousands of dollars just to keep their primary instead of switching to someone that may take their insurance. So let's say you want to, the most common though is like, if you want to go to doctors out of state, where you're going to sign up for what's called a Medicare supplement or a Medigap plan. And I definitely want to cover this because there's two routes. You either do the HMO, which are more of the free plans, or you do, which believe it or not, in my opinion, based on my book of business, 8 out of 10 clients do these plans. They're amazing. They're super amazing, top of the line. My mom has one. All right. So, or you can do what's called the Medigap or supplement plan. I don't know if you've heard of that, but they advertise all the time on TV, especially United Healthcare. And these are paid plans. The most expensive one is about $300
per month.
Now, per month.
Okay. Wow.
Okay. Versus free with the HMO. So if you said, hey, I want to go to anyone I want, I don't want to have to check to see if my doctor's in the network. I want to go fly myself off to the Cleveland Clinic. I want to go to a hospital in California. I want to see my doctors in California. I want to see my doctors in Carolina. Wherever you are, then you would do what's called a Medicare supplement or a Medigap plan. Right.
We're running low on time. Real quick, okay. I'm going to ask you, if someone is living, let's say, here in Maryland, and then she has to move, the mother has to move with her daughter who's in Alabama, how does that work if they're within, I guess, a HMO type of plan?
Well, what I would highly consider, and if it was my client, they'd call me and say, I'm moving to Alabama now. Okay. So if you didn't have the supplement, remember that supplement works all over the United States. So it doesn't matter. You can move 100 times. It doesn't matter. It's going to work everywhere. But it does not come with a drug plan. I want to be clear with that. So there's another cost for the drug plan. So it's $300 and approximately between $50 and $100 more for the drug plan. So this is what you're asking right now. If someone called me and said, hey, I'm moving, I'm on the HMO, I would check to see that qualifies as a special enrollment period, a SEP. It allows them to change their plan to a plan to wherever they're moving. So if they're moving to Alabama, I would look up the number one HMOs, especially if they're on a free one. What is the comparable one there? If they're with Empire, Blue Cross Blue Shield, it may still be Empire down there, just under a different name. And then we would switch them after we review if they have doctors. And most likely that plan is going to be free as well. But that client wouldn't stay on an HMO in New York because the HMOs, those Part C's and D's are for the state that you live in. Yeah. So if you are on a Medicare Advantage plan, most of them don't have the ability to allow you to go to other doctors in another state. A few do, but that's a little bit more of a different conversation than today. A few do, but for the most part, the simple answer is most likely you're going to change. And if you're going to now live with your relative out of state, you most likely will need a different plan unless you're on that supplement.
Got it. Okay.
But it's fine. The plans are great everywhere. Yeah. You wouldn't even skip a beat.
And I love the fact that you're the person, they just make a call to you and know that it's going to be done. And also their adult child knows that it's going to be taken care of because they're already busy and probably overwhelmed with having to move mom or dad with them and everything else that they have to do. Do you have anything else that you could share like in the next minute and then let potential clients know how they can reach you?
Well, I mean, for me, it's like I said, it's open enrollment now. I mean, some people come in early for a disability. So, sometimes I have clients that are 40 years old. So there are other reasons why people get into Medicare. There's one last portion of Medicare that I'd like to cover, which is people that have Medicaid with Medicare. Okay, these are called special needs plans. Okay, so I've already covered the Medicare Advantage plans, which are the HMOs, the supplements, which are more of the paid plans, but then there's the special needs plan. People that have Medicare with Medicaid. Usually people make under $17,000 a year that have Medicaid, but these are HMOs as well, and it gives people with Medicaid and Medicare even more benefits. Okay, first of all, the plan is $0 a month. They're going to get approximately, some of these companies have $100 a month to buy products from Dwayne Reed plus healthy groceries. Even this year, some of the companies have added on paying for your utility bill. through what's called an over-the-counter credit card. They get transportation. So because you have Medicaid also with your Medicare, and you can have both, you get even more benefits and more access. So I want people to be aware of that as well.
Wow.
So, but yeah,
lives. That's amazing.
I mean, you hear conversation all the time in politics. Oh, Medicare is not going to be around. Personally, I don't really believe that, because it's people like me and you who have been working our whole lives. You actually see in your check, it's taken out. Your Medicare is prepaid basically. So when you get to age 65, where most people come into Medicare, this is an entitlement. So I wouldn't get scared in the politics of talking about Medicare. Of course, Bernie Sanders, who is running on the platform, he wants Medicare for all. I don't really think that's possible because, obviously we paid our whole lives into the system to have this Part C and D handed to you if you want for $0 a month. People are paying, like I said, between $500 and $1,200 a month for these insurance plans. But people on Medicare are paying between $0 and $300 a month for their plan.
Got it.
Okay.
So, Stacey, how would a potential client reach you and reach out to you?
Okay, so I'm happy to help anyone in the United States with any Medicare questions. I can be reached directly on my business phone, which is 917-674-5404. I'm also very accessible. If you go to the website, the Jones Insurance Agency, you can fill out your contact there. It comes right to me. The alert comes right to me. I'm happy to help you by email as well. But the great thing about this business is most of the time, this is 99% of the time now, everything is done virtually. So we can set up a Zoom meeting. We can set up a FaceTime meeting, or we can just do everything over the phone without even seeing each other. Everything's done by email, text. Everything is done through voice enrollment these days. So it's actually one benefit of the coronavirus. I hate to say that, but it is kind of true. It kind of is true. I'm able to help double the amount of people that I was helping before the coronavirus, because I do mostly everything from the home office.
Yeah, pretty awesome. Thank you so much, Stacey. And if you want to come back and share some more information about this, because this is a very important topic, please come back.
Yeah, actually, I would love to also talk to your potential viewers about life insurance as well. So I actually do that. I do everything in the insurance space. I know today's discussion was primarily Medicare, but life insurance is an important piece as well. So maybe one day we'll speak about that as well.
Thank you so much for joining us.
Okay, thank you. Have a great